Thank you. My name is Ekta Srinivasa, and I'm a registered nurse with 18 years of experience in various nursing care delivery settings. Currently, healthcare settings lack psychological safety, as evidenced by repeated strikes by nurses asking for a better work environment, high attrition rates, burnout, and poor health outcomes for our patient population. Despite rising healthcare costs for individual consumers and our country, we still fail to deliver better health outcomes for the patients. Healthcare systems operating under a business model, fearful of litigations at every step, have resorted to creating a culture where the leaders design a system of silence, grant informal powers to everyone willing to show blind obedience, enabling a culture where cliques are formed and where hiding errors become easier. There's also a growing culture within the healthcare systems where sentinel events, including patient deaths, are being blamed on an individual caregiver to avoid systemic responsibility and lawsuits. Lack of psychological safety in healthcare cultivates a culture routinely generating poor patient care. There are several reasons for lack of psychological safety in healthcare. First one is obviously the ubiquity of workplace bullying. There is a causal relationship between workplace bullying and patient safety outcomes, such as higher rates of falls, more medical errors, and higher infection rates, to name just a few. Despite the evidence, employers have largely ignored the issues and failed to take meaningful steps to prevent, mitigate, and victims of workplace bullying. Second reason for lack of psych safety in healthcare is that the internal and external recourse systems are inefficacious, outdated, and need to be up to speed with the research on workplace bullying. This is similar to domestic abuse. When we had more evidence, the actions taken by recourse processes became different. Although access is provided to file a complaint, the system does not evaluate the long-term equity and outcome of utilizing the recourse process. The lived experience of individuals who utilize the recourse process garners even more reprisal, retaliation, and mobbing, which involves expulsion. For example, 80% of EEO cases fail to meet the standards. Perhaps our system is overwhelmed, as it might be in this case. Only judge assigned to review EEO cases for the Boston area, through her tenure from 2018 to 2023, it turns out that all cases brought in front of her, she dismissed it, not allowing it to go past the summary judgment. I have learned that cases related to workplace culture is usually considered the employer's responsibility. When our legal systems
That's going to be very helpful if you can put that in writing.